these were things that they had to do. So they were doing it judiciously because these were like literally part of their everyday activities. It was like their lifestyle. Do you understand? But it's a sad thing that right now we like soft life. Me too, I like soft life food. Hello my loves, welcome back to my YouTube channel. If you're a returning subscriber, thank you so much. Thank you for subscribing to my channel. Thank you for watching my videos, for liking them, for your comments. I am so grateful. Then if you're seeing my face for the first time, I hope you subscribe to my channel. I hope you like my videos, share with your friends, your family, and your well-wishers. Our topic today will be hypertension. Yes, I know that hypertension is like something everybody hears every time, but today I'm going to be telling you the things you need to apply, the things you need to know, this in the simplest form ever about hypertension. So hypertension is, yes, high blood pressure, right? And in Igbo we call it obarambanielu. According to the World Health Organization, hypertension is defined as persistently elevated blood pressure greater than 140/90 millimeters of mercury on 2 or more occasions, at least 4 hours apart. The diagnosis of hypertension is not gotten from a single blood pressure reading. You must have checked the first time, checked at least the second time before you can say, okay, I'm having this disease, this condition. There are risk factors that would increase your chance of having hypertension. Before I talk about these risk factors, I would want you to know that hypertension is a silent killer. It is termed this because you can have this disease and you wouldn't have any signs or symptoms. And then the next time you will now know that, okay, this is hypertension, is when you have come down with complications. And there are so many life-threatening complications that hypertension can cause. Now, the risk factors of hypertension can be factors that are within your control or factors that are not within your control. So now, for factors that are not within your control that can predispose you to having this condition, advanced age, so once you're getting advanced in age, then your chances of coming down with this condition increases, right? Then family history of hypertension. This is what you cannot change, you can't control. That your family, your father, your mother had this condition is something you can't control. They've had it already, so there's the risk of you having it. Then the risk factors that are within your control that you can modify, that you can change, are obesity or being overweight. So I know that many of us get really sensitive when people try to talk about our weight, and it's really understandable, trust me, because personally I don't see the need telling someone about the person's weight and not preferring a solution or making the person understand what this increased weight can predispose them to. Now, concerning this weight, now, it's not everybody you see that looks a type of way that is not in sync with what you believe an ideal weight should be, that is obese. That's the truth, because WHO has said that for you to say someone is overweight, the person's body mass index, which is the BMI now, should be above 25 kilogram per meter square. That's for overweight. Then for you to say that someone is obese, the person's body mass index should be above 30 kilogram per meter square. Now, someone can be really tall and a bit big, and then you see the person and you're like, oh, you're overweight, but the person's height automatically balances out the weight. That if you check the BMI, which is calculated using both the weight and the height of this person, the value may not boil down to the category of being overweight or obese. Another risk factor that you can control is your diet. What do you eat? What constitutes the most of the diet you consume? The major implicating thing in our diet that predisposes us to having high blood pressure is salt, daily salt intake. And the thing is that We cannot overemphasize the importance of salt in our diet. We use it to wash our fruits, wash our vegetables. We use it in cooking virtually every meal. It makes the meal tasty. Even the Bible has said something about salt and taste, right? So it makes the meal tasty. And personally, I know that I cannot cook without salt. I won't be able to eat that food. But now there has to be a regulation on the amount of salt you put into your food. I've heard of people that actually use salt to eat food, not to wash it all. When they want to eat it, they put salt. I can remember that when we were growing up, when you want to, udara, they call it star apple. When you want to eat star apple and it is slapping, they say rub salt on top. You rub salt, you apply salt on top before it is inside to not slap you. I don't know if every other person did that, but I can remember that when I was very little, that was like the thing that time. If you're doing that, kindly stop it, I'm begging you in the name of God. You know this habit of when the food is done, you bring it out, you serve the food, and then you taste it and you feel, oh, there's no salt. You're not gonna bring salt and now put inside the food that's already on your table. Bad now. So all those things are things you should automatically cut down, irrespective of the fact that it will be really hard to cook without salt. But you see, these extra habits that we do that are not necessary. We should really please abandon those ones. Now, another risk factor that you can control that can predispose you to having high blood pressure is smoking and alcohol intake. Now, guys, the thing is that we usually think that smoking is basically cigarette though. That is the funny thing. That is not all that smoking entails. There's something we call secondary smokers. Now, secondary smokers are people that, you know, you're in an environment where people smoke. You're not smoking, but others are smoking. And the sad thing about this thing is that you're literally consuming more of the smoke than the person that is smoking. Because the cigarette has a filter. That cigarette stick, the other end has a filter. So literally, the filter helps to like purify the smoke basically that goes into the person's lungs. So the soot that goes in sort of reduces. But you, on the other hand, now that you're just facing the person or sitting down in the same place with the person, will take in everything. And then smoking and cigarette actually includes shisha. So I feel people see shisha as a safer option to cigarette smoking. My brother, my sister, it's the same thing. Another risk factor that I would be telling you, this one, everybody is on this table. Stress, my people of God, stress. The amount of stress you predispose yourself to would actually increase your risk of coming down with a lot of non-communicable diseases, and not just hypertension. How many hours of sleep do you take in a day? Yes, I know that the economy is bad. Things are hard. It's hard for everybody, and everybody is trying to find like a means of survival. The thing about stress is that in as much as we have so many worries, challenges facing us in this life, you should have to try to leave the ones you cannot change. Anything that has happened in the past or in the present, and you know that you cannot change it, just leave it to God and move on. Don't dwell on it. Remember, I said initially that blood pressure may come without signs and symptoms up until you've had complications. So what are the symptoms that you may have? You know, if it is symptomatic, you can have dizziness, you can have chest pain, you can have persistent headaches, difficulty in sleeping, difficulty in breathing, you can have blurring of vision, you can have calf pain, you know, a lot of other things that you may have if your hypertension becomes symptomatic. What is the way forward? How can we prevent ourselves from coming down with hypertension? Now, I've talked about the risk factors. So now basically, if you want to reduce your chances of coming down with this high blood pressure, right, basically is just to modify those risk factors that are within your control. And how do you do this? Number one, your diet. Reduce salt intake to the barest minimum. I think WHO recommends at least 1.5 gram a day. But we are Africans, we're Nigeria, how we want to be measuring 1.5 gram every day when we want to eat? Reduce your discretion and reduce. If normally you put 2 teaspoons of salt in your food, put 1. It will still be tasty. So try your best to reduce salt intake. Modify your diet. Your diet should be rich in fruits and vegetables. Now, another thing, this one is very important. Everybody is on this one, is physical activity. Now, the thing about physical activity and why hypertension is even increasing even in the younger age group now is that in the olden days, our forefathers and our ancestors, they used to trek. They trek to school, trek to the market, trek to the stream, trek to, so irrespective of the fact that at that time we did not have gym, we did not have treadmill, but the child used to trek well. So that is like a form of physical activity. They used to do farm work well, so that was like their own form of physical activity. And irrespective of the fact that they were not seeing it as a way to exercise or be active, these were things that they had to do. So they were doing it judiciously because these were like literally part of their everyday activity. It was like their lifestyle. Do you understand? But it's a sad thing that right now we like soft life. Me too, I like soft life. The truth is that with this economy now, it's not everybody that can afford to go to the gym. Me, I cannot afford to continue paying gym membership every month. And that is why high income earners now can comfortably afford to pay monthly gym membership, right? And they are being happy, they are living their life, they are healthy. But me and you now, the middle and the average income earners now that cannot afford to pay monthly gym membership, we have to now prioritize physical activity. So the way you know that naturally you will take a bus, you can trek half of the distance and take, if it is really far, trek at least for 30 minutes or 20 minutes and then take a bus for the remaining distance to be covered. Do you understand? So that can be a way to increase our physical activity. I know many of us right now are either civil servants or we have one office or the other, so we sit down in that office from morning till night. In fact, some offices have elevator, so even to climb steps, if you know, go climb. So we should intentionally incorporate physical activity, at least 30 minutes of physical activity every day into our lifestyle. The thing about exercise is that I don't know if you have ever maybe tasted your sweat. Probably you're sweating and for some reason it enters your mouth and then you taste it. Sweat is salty, right? So this is how your body tries to eliminate the excess salt that has accumulated in your system. So when you exercise and you sweat, you kind of excrete salt. And aside that, it also helps to boost your cardiovascular health, your heart health. Exercise also helps you to lose weight. Losing weight then helps to avoid fat deposition on your blood vessels and your heart. I talked about alcohol and cigarette smoking. You should avoid it. Smoking has no benefits for you, my dear. Then this one, the easiest of them all, regular blood pressure checks. Now my family and my friends, my loved ones, I'll end this video by telling you about the complications of hypertension. And there are so many complications of hypertension, but let me just tell you the common ones. It's stroke. Hypertension is one of the commonest health conditions that can cause you to have a stroke, right? So yes, you may not be having signs of hypertension, you're fine, and all of a sudden one day you just have a stroke, and then they watch you to the hospital and check your blood pressure and they're seeing that it's elevated. So please, yes, stroke. Number two, this one we call heart attack. You know, in medical term, we call it myocardial infarction, but we all know it as heart attack. Hypertension can cause heart attack. It can cause heart failure. It can cause kidney failure. It can cause literally a whole lot. Another complication is blindness, retinal damage. Hypertension can damage the blood vessels that supply your eye. Imagine coming down with a stroke, and you could avoid that stroke by just checking your blood pressure for 500 naira at the pharmacy store, or at least once a week, or by exercising, or by reducing salt intake, or by stopping smoking. These are like things that you can naturally just stay on your own and just do, and then you come down with a stroke. I know that one thing must kill a man. Let this one not kill you, right? Let something that will kill you be something that you couldn't control, or you couldn't predict, or you didn't predispose yourself to. So try to put all these measures in place so that you will live a healthy life. Even if you have the risk factors that cannot be controlled, you shall be on medication. Right now, there are so many antihypertensives or medications that your doctor will prescribe for you that you will take and your blood pressure will be fine. So please, I hope you have learned a thing or two from this video. Thank you for watching this video to the end, and I hope you share it with your family, your friends, your loved ones, and your well-wishers.